This video is going to describe the intrinsic conduction pathway of the heart. We're going to talk about the pacemaker. We're going to talk about the EKG and hopefully get to some abnormal EKG readings. So here you have the image. I believe you received this image. It's already labeled for you.
The SA node initiates the depolarization impulse, which, in turn, generates an action potential that spreads throughout the atria to the AV node. Here, the impulse is delayed briefly before continuing on to the ventricles through the AV bundle, bundle branches, and Purkinje fibers. Action potentials, which spread from the autorhythmic cells to the contractile cells, are electrical events. The subsequent contraction of the contractile cells is a mechanical event that causes a heartbeat.
So you'll notice the signal starts here at the SA node, goes down the internodal pathway, collects here again at the AV node. AV node is a good name for it because it's the atrioventricular node. It's right here between the atria and the ventricles. Then the signal goes down the septum of the heart between the two ventricles. Those are called the bundle branches. And then the signal goes up the exterior wall of the heart through these things called Purkinje fibers. I want to talk to you for a second about this SA node. This SA node is sometimes called a pacemaker. And in class, I showed you a couple of actual pacemakers. Here's a more recent model. But when a patient's own nervous system's pacemaker is not functioning properly, you'll have one of these installed to take care of the heartbeat for the patient.
In this animation, we see heart electrical activity reflected in an ECG wave tracing. The P wave represents atrial depolarization. The QRS complex represents ventricular depolarization. And the T wave represents ventricular repolarization. Please note that in a normal ECG wave tracing, atrial repolarization is hidden by the QRS complex.
So your normal EKG or ECG. EKG stands for electrocardiogram. Cardio in German is spelled with a K, not a C. So that's where you get EKG, ECG, same thing. You're looking at the electron or the electric current going through the patient's heart.
These diagrams show the correlation between heart electrical activity and an ECG wave tracing. The P wave represents atrial depolarization, which is followed by atrial contraction. The QRS complex represents ventricular depolarization, which is followed by ventricular contraction. And the T wave represents ventricular repolarization, which is followed by ventricular relaxation.
Notice here, the signal goes, both atria contract, the signal goes, both ventricles contract. So atria contract, ventricles contract. Atria contract, ventricles contract. Atria, ventricles. Atria, ventricles. Now watch closely and notice where on this ECG, where's the bouncing ball when the atria contract and where the ventricles contract. I think you'll notice that the atria contract when the signal is right there, and the ventricles contract when the signal is right here at S. So Q marks the atrial contraction, and S marks the ventricular contraction. All right. So if you'll find this document, I believe you picked it up on, handed out Thursday. You have this little EKG. Okay. So this P is marking atrial depolarization. Basically, the atria are getting ready to contract. Okay. The QRS is ventricular depolarization. And that again means it's just simply getting ready to contract. Okay. What does depolarization look like? Remember in class we talked about the sodium ions and the potassium ions swapping places on the outside of the membrane? That is depolarization. So it's getting ready to make that action potential, make that action happen. And for our purposes, we're going to say Q is where the atria actually contract. And S is where the ventricles contract. Okay, the T wave, this bump right here. T wave is when the ventricles repolarize. Which simply means they reset. They get ready to do their thing again. That's when the sodium moves back where it belongs, the potassium moves back where it belongs. Now, we see that the atria depolarize, ventricles depolarize, ventricles reset. Where do the atria reset? They've got to reset. Where does that happen? The atria reset also here in the QRS. So there's kind of two events happening at QRS. The ventricles are depolarizing and the atria are repolarizing. No space. Atria reset or repolarize. So what do you notice? If you were in first grade, what do you notice the difference between this wave and this wave? Any first grader will say, oh, this wave's bigger, this wave's small. Exactly. Why is this wave bigger? This wave is bigger because you have two events happening at QRS. You have the ventricles depolarizing and you have the atria repolarizing. All right. Right here at this mark, right here, what is happening there? The whole heart is resting. The whole heart is completely chilling. But, you can see that right there. What happens if that's all you see? Straight. Okay. Maybe you've seen that at Grey's Anatomy or some other medical show. EKGs go beep, 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 beep. Okay, what do we call that? That's called flatline. What does that mean? That means that the heart's not working. The heart should pick up again and do the atria thing. But in the case of flatline, that doesn't happen. So you need to make changes to make that heart start. Okay. We'll look at abnormal and normal EKGs in the next video.